We often talk about our mental well-being using terms like stress, anxiety, or burnout, especially in relation to work or study. But what do they really mean, and what should we be looking for when someone close to us is struggling? Stress is when a demand of some sort is placed on our minds or our bodies. Stress is a normal part of being human and not necessarily a bad thing. A certain level of stress can improve our performance and motivation, for example, when training for a competition. However, when stress is too great or our resilience is low, we can feel overwhelmed and go into threat mode, which can feel a lot like anxiety. Many of the simple techniques we use to manage anxiety, like relaxation, grounding, rest, and self-care, can help to relieve stress as well. The key difference is that stress tends to be short-term and related to a particular situation, experience, or trigger. On the other hand, anxiety may persist long-term even in the absence of a trigger. Chronic stress can be hard to distinguish from anxiety and may contribute to developing a long-term mental health condition. So it's important to recognize stress and find ways to reduce its impact on your well-being. Burnout is another response to chronic stress and typically relates to our working life. Burnout symptoms include feeling fatigued or exhausted by work demands, becoming unmotivated, detached, or negative towards your job, and lacking a sense of meaning or accomplishment in your role. Burnout and depression have some features in common, and it may be difficult to distinguish them. If you or someone else is struggling with burnout or are worried about depression, speak to your manager, occupational health team, or doctor. Psychological therapy or career coaching can be helpful to identify and manage sources of stress at work and make positive changes that reduce burnout.